Which of following interventions is most likely to be effective in treating this patient's skin lesion? 62-year-old man presents to clinic with 1 centimeter rough scaly patch on his right forearm, present for about 4 months, not changed in size or appearance. Patient has a history of outdoor work and chronic sun exposure. Lesion is non-tender and erythematous. Let's see. I just had a question like this earlier, but it was just like sunspots. That's not what this is. This seems to be more, could be squamous. I mean, the retinoids they like a lot for acne, photodynamic therapy. I'm not sure really what that is. Sounds like a sort of a light therapy. Oral antibiotics would be some sort of infection. I don't think this is infectious if it's scaly, rough on his right forearm. Cryotherapy is like where they freeze something off. A lot of the time they'll do that with like warts or like skin tags even sometimes. So topical hydroquinone. I don't think I know what that is.
Okay. What do you think
Um,
the diagnosis for this man is?
so
If you were to put something on, I think you mentioned some things, but
so yeah, like it could be like a squamous cell in that family. So we have actinic
okay,
keratosis, I think.
okay, good,
Um, I don't think basal cell because
okay,
it's
good,
not like above on the nose or upper lip, but like upper lip and above. So it definitely goes squamous.
okay,
Yeah, I like actinic keratosis for like a farmer or someone who works outside like that a lot
cool.
on their
I like that.
arm.
I like that diagnosis. So, what do you want to do for, let's say, it's actinic keratosis, or some.
Well, right off I'm thinking like 5F or yeah, 5FU, methotrexate family, like all of that stuff. And I don't see that here. So I'm like, okay, what? I don't think it's vitamin A because that they talk about that a lot with like acne, and I
Okay,
don't know what photodynamic therapy is. I'm not sure what hydroquinone is.
what's your gut say here?
My gut would say because I remember seeing a case like this in family, and it's like, yeah, he gave like topical 5FU, and I'm like, topical seems to be the. I don't think you'd want to add more sun. I would put that, but I don't know what that really is, and I don't like. I usually don't choose things I don't know what. Like if I can't
Which
think
one
of what
you
they
want to do?
call it,
A
I
or
would. I
what?
would A, but I'm not. I'm not confident about it.
Okay. So let's actually look.
Okay, it's
So
cryotherapy.
actually,
Okay.
yeah. So actinic keratosis, you can actually. I've seen some people use cryotherapy for it. Okay.
Okay.
It's definitely one thing you can start off with. Okay. 5FU is a good. It's like a chemo topical agent, right? That you can do as next line. Topical
Yes.
quinone, right, is actually used for hyperpigmentation disorders, so melasma or hyperpigmentation,
Uh.
and it kind of
Okay.
makes it not hyperpigmented. It makes it more
So like
white.
it depigments it in a way.
Yeah, yeah, and that
Okay.
works with melanas or it denatures, I think, tyrosinase. This is ironically, this was on my board exam. Okay, so that's the
Oh,
fun
okay.
how that works on the skin. Antibiotics, you're
Is
never gonna
that is that the one that would help with like vitiligo? No, because vitiligo it's usually
the opposite, right?
opposite. Okay.
Vitiligo is
Okay.
you're losing pigmentation, right?
Okay.
So, and then antibiotics, that's not going to help, right? Topical
No.
retinoids, right? Like you said, acne, right? Some cases
Hmm.
of mild, but not really, right? Cryotherapy is usually the one you start with here. And then photodynamic
Okay.
therapy is another treatment, but typically reserved for multiple lesions, cannot tolerate cryotherapy.
What is photo? I don't know what photodynamic
Uh,
therapy is. Okay.
let's look it up together here.
Okay.
Uh, photodynamic. Let's see here. Treatment used for photosynthesized agents and a specific type of light to kill cancer cells. Um, so,
Hmm.
so kind of interesting. I haven't seen this before, but once again, I'm not really in derm world very often. So,
So it must be like a certain either wavelength of light or something that they blast it with. Okay.
yeah. All right. Perfect.